I'd like to now welcome our OIF CEO, Tracy Hart.
Good morning, everyone. Thanks, Melissa. It's so great to see everyone. I'm scrolling through, seeing so many familiar faces, and it's so great to see everyone. I hope you had a great day yesterday. I know there was a lot of information shared. I thought it was a really good day. The social events were fun. A big shout out to the people that participated in the escape room last night and all the other social events that happened. And many thanks to our medical professionals who are really guiding us through putting on such a meaningful conference. I also wanted to quickly, I know I'm looking through some of the faces that are on here. We have many former and current board members. So I just wanted to thank you all for your continued service to the OIF. I see Kara Ayers on there and Susie Wilson and Carolyn Tipton and many of our former board members. So I just wanted to thank you for your continued service to the OIF. We're going to get started in just a minute here with the Ask the Expert session, which I think will be fantastic. So I know that you all have decided on which session you want to go in, and Melissa's going to tell us how to do that soon. But before we do that, I wanted to sort of kick off our participation in the impact survey. You've heard a little bit about it. It's a wonderful collaboration with the OIF, the OI Federation of Europe, and our friends at Mereo Biopharma. It's a survey that will look at understanding experiences based on your lives and your experiences as someone living with OI. So I wanted to make sure that we talked a little bit about that. And to do that, I'm going to turn things over to Ted Trahan. Ted is the treasurer of our board of directors and member of our executive committee. And Ted's going to tell us a little bit more about the impact survey. And then we're going to hear from Dr. Kathleen Raggio and Katrina Baish, two members of the impact survey committee. So Ted, I'm going to turn it over to you.
Well, good morning. I am Ted Trahan. I'm serving as treasurer on the board. And yesterday, you heard about a couple of surveys. Dr. Laura Tosi talked about the survey assessing the impact of COVID-19 on the OI community. Dr. Krakow has a survey exploring postpartum effects. And these surveys are important in their own right. This morning, we have a team to describe a different kind of survey, one that has global implications. So consider this background. In Western medicine, insurance reimburses therapies when there's a body of evidence showing that the therapy works. Patients benefit through lower costs when therapies are covered by insurance, and drug and medical device companies benefit through larger markets for their products when their therapies are covered by insurance. So how do we expand insurance coverage for factors impacting health systems and quality of life with OI without a body of evidence? So our colleagues at Mereo proposed a win-win idea. Why don't we develop a body of evidence through a survey of individuals and families with OI, and do that by working through the European OIF organization and the US OIF organization. So these foundations responded, hey, that sounds like a great idea. Be aware though that our members of the OI community have an expectation of privacy. So the outcome is the impact survey on quality of life. This is the first international survey, and the data will be from the patient's perspective. At the same time, any personally identifying data is deleted after the results of the survey are published. And then following the survey, that data will all be managed by Dr. Frank Rausch, who is a member of the OIF Medical Advisory Committee. So to describe this impact survey, I would like to introduce the members of the steering committee. Katrina Baish. Katrina's family has a long and productive and supportive history with the OI Foundation. And most recently, Katrina served as a representative of the OI community on the Impact Survey Steering Committee. Dr. Kathleen Raggio specializes in general pediatric orthopedics, scoliosis, and in the treatment of osteogenesis imperfecta and skeletal dysplasia. Dr. Raggio performs basic science and clinical research and is currently on the OI Foundation's Medical Advisory Council. And it's great to have her speaking at the OI conference again as well. So Dr. Raggio, I'll turn it over to you.
Good morning. Thanks so much, Ted, and thanks, Tracy, and everyone. It's really fun to be in little boxes on screens together. I mean, it's better than nothing, but I can't wait to be there to see all of you in person. And I know we've had some great meetings. So I think that's what I would like to make about this survey to you, what I want to say to you about this. I think it's very important. And why do I think it's important? I think it's important because it is, as Ted already said, our first stab at and to
Dr.
really
Raggio,
see what,
there you go.
And what does
we briefly lost your audio.
Oh, sorry. Okay, sorry. I apologize to everyone. I explained I'm in some place where on Sunday mornings they take away my internet. But anyway, so it's really important. And why is this survey important? And what do I want to talk to you about it very briefly? One is it's going to allow us to work together to really advocate, as Ted said, for better services. I know many and maybe for some respite time, until we have data that we can go to governments and go to insurance companies and say, this is part of what it means to have OI. This is not different. This is not excessive care. This is what it means. This is what we need. Let's stop the nonsense and let's get on with coverage that is appropriate for this diagnosis. So I think that is so important. And people often say, well, I'm doing fine. Why should I fill out a survey? It's really important for us to have the biggest denominator possible, because that allows us to have more meaning. Not doing well, or you've done great. So I really ask everyone to take the time to fill this out. We also want to make a little special thing to the males who have OI, because we have very little data on males in OI. And I think it's going to be so important for us to have that. We would like to have as broad an audience response as possible. So having said that, I'm going to now pass it on to my committee member, Katrina Bache, who's going to give you a few more pointers about this, I hope, and also hopefully you can hear her in case I completely got lost. Thanks so much. Have a great meeting, guys.
Good morning, everyone. Thank you, Dr. Raggio. I just want to welcome everyone and welcome you to our second virtual conference. While the last year and a half has presented many challenges for us all around the world, it has also provided an opportunity to reevaluate the way in which we interact. The result of this has provided greater accessibility for many disabled folks. And while I was sad to see we had to go yet another year without an in-person conference, I'm thankful that we are able to connect in such an accessible fashion. The OIF has continued to make strides in both their virtual presence and accessibility. We have broadened our captioning capabilities and have furthered efforts to be as inclusive and accessible as possible. And on the front of inclusivity, I'd like to talk about the survey Dr. Raggio just introduced, the IMPACT survey, which has been a global effort within the OI community to take a comprehensive look at living with OI. I am a firm believer in the adage, nothing for us without us, which holds fast to the idea that disabled people must exercise our voices in all aspects that impact our life, identity, and well-being. That is why I was so excited to have the opportunity to work with other OIers from around the world on the IMPACT survey. I ask that you take just a few minutes of your day to complete this online survey. The survey is de-identified, meaning your personal information and identity will not be used in the collection of this data. The efforts of this survey have been funded by Mereo Biopharma, with the ultimate hope of not only collecting a global census on living with OI, but also possibly furthering the advancement of drugs to treat OI. And what's so exciting about this survey is that it is one of our first global efforts. And so for the first time, we really get a picture of living with OI around the world. It's being disseminated into multiple languages in multiple regions. And this will give us a glimpse of OI in the 21st century. As I said before, it'll only take a few minutes, and it is a really exciting opportunity. So please take a minute today. We are linking the survey in the chat, and I did it, it only took me about 10 minutes. So everyone have a wonderful rest of the conference, and thank you.
Thanks, Katrina. And if I could jump in here for just 1 second, Melissa, this last slide shows the members of the steering committee. So you can see this is a true global effort, as both Dr. Raggio and Katrina mentioned. So please take a few minutes to fill out the survey. We really appreciate it. And thanks so much. And Melissa, if I can take 1 more minute. Katrina also mentioned our diversity, equity, and inclusion efforts here at the OIF. And I know our DEI consultant, Chaz Kellum, I see him in a box, as Dr. Raggio said, is here. He will be leading one of our breakout sessions. And I know he would love people to drop in and ask questions about our efforts here to really be as inclusive as possible in providing services, materials, opportunities for the entire OI community. So with that, I'll be quiet now. Thanks, Melissa. Back to you.
No problem. We also did have one question in the chat that I think other people are probably thinking. They're wondering, is mental health addressed on the survey?
So I don't know, Katrina, if you want to take this, or I can. Yes and no. I mean, it's a quality of life survey, so there are a few questions that are that deal with mental health, but not a lot. So, Katrina, did you want to jump in there?
Yeah, so it does give a brief overview of quality of life. I think what's really interesting, and one of my favorite questions was, it even addressed romantic relationships. It addresses socialization, work, quality of life, and it's really stepping away from the medical model of disability. And what that means is it's not adhering to curative ideology. This isn't just about, oh, do you want to see OI cured and what is your medical prognosis? It is talking about well-being. And this survey is fairly brief. It tries to cover a lot of aspects of life. So it's not in depth for mental health, but it does cover several aspects of well-being.
Great, thank you so much. So as Tracy mentioned, we're now going to move into the breakout sessions, so the Ask the Expert. We're so excited to have our expert panel today with us. Those of you who have attended a live national conference might be familiar with our medical consultation program. If you have attended a regional conference, you might be familiar with the curbside consultations or the lunchtime consultations. And we put this morning together to help to bridge that gap until we can all be together again in person. So what we have today is we have 7 individual breakout rooms that will open up shortly. When they open up, you can select where you'd like to go. You can select how long you'd like to be there. You are welcome to come and go from any of the sessions and to have a conversation with our experts. As I mentioned at the beginning of this session, these are not telehealth. Our doctors and our experts cannot advise you in your specific cases, but they can give you general information. So as Tracy mentioned, one of the sessions this morning is Diversity, Equity, Inclusion, featuring the OIF's consultant, Chaz Kellum, who can give you feedback and learn about the work of the OIF and what we're doing to be more inclusive to the entire OI community. Another of the breakout rooms will feature Medical Advisory Council member, Dr. Laura Tosi. And and she is going to speak on patient-centered outcomes research projects, including an update on the OIF's COVID-19 survey. We'll also have a room with Medical Advisory Council member, Dr. Sandy Sandhouse, who will answer your questions on pulmonary health. Deb McInerney from Hospital for Special Surgery will be available to answer your questions that you may have on nutrition and OI. Next, we have Dr. Megan Wallace from the Children's Hospital and Medical Center in Omaha, and she'll be able to answer any of your surgical questions. A little note on that session, that one will close at 12:15. So if you have questions for Dr. Wallace, I would do them sooner rather than later. We also have another OIF Medical Advisory Council member, Dr. Reed Sutton, who will be available to answer your genetic questions. And finally, we have former OIF Board of Directors member, Dr. Kara Ayers, who will be able to answer your mental health questions. I know I saw a lot of mental health questions in different sessions yesterday, so I think that might be a big session. So without further ado, we'll open up those breakout rooms. If you have any questions, by the way, you're welcome to stay in the main room, and we'll have one of our staff members here, Danielle, who can help direct you to breakout rooms as needed. So if you look at this, the pop-up that came up on your window, you scroll down, you can use the blue join button to move yourself into the rooms that you would like. All right, and with that, well, I hope everyone has a good Ask the Expert session, and we will see you later on.